This presentation is teaching for liver cancer and ways to prevent it for the age group of 18 to 21. First off, what is the liver? It's a very important organ in the upper right part of your abdomen. It does a lot of things for the body, so it is vital that you take care of it because you only have one. It's made up of hepatocytes, which are also just liver cells. It breaks down and stores nutrients. It makes clotting factors, so when you start bleeding, the liver helps you to stop bleeding with those clotting factors it makes. It also breaks down alcohol, drugs, and toxins. This includes drugs that are prescribed or drugs that are used on the street. So that's an important thing to know. What causes liver cancer? It's those hepatocytes we talked about becoming damaged. Oh, sorry, I don't know. They become damaged or changed in a way that allows them to grow out of control, which is essentially what any type of cancer is. Those are also known as mutations in the cells, which cause tumors. Other cancers can also spread to the liver. The blood goes through the body, and say someone had breast cancer, the blood might travel and go through the liver and spread the cancer there. Here's some risk factors. Hepatitis B or C, those are spread through bodily fluids. Cirrhosis, which is scarring of the liver, can be caused by alcohol and other substances. Inherited liver diseases like hemochromatosis or Wilson's, which can't necessarily be avoided. Diabetes, non-alcoholic fatty liver disease, which is just when you have fat on your liver. Aflatoxins, this is from crops being stored improperly, and it's something you would consume. Alcohol and tobacco, long-term use of anabolic steroids, and obesity. So prevention is the most important part. We are going to want to avoid alcohol and tobacco altogether if possible, or drink in moderation. Maintain a healthy weight. Get your Hep B vaccination, especially if you want to work in a hospital or if you're going to be doing things that might be risky. It's good to get that vaccination so that it won't be spread through those bodily fluids, specifically blood. Avoid risky behaviors. So this is drugs with used needles that might spread that Hep B and Hep C. Unprotected sex. Contaminated tattoo or piercing needles. So this would be if you went to maybe a sketchy place for a piercing or tattoo, they might not take good care of their needles, and you could also get Hep B or C that way. Watch for signs of liver disease and seek early treatment. So if you feel like something's not right, make sure you're going to the doctor and you're getting your check-ins and you're taking care of your body, keeping up with what it's telling you might be wrong. Here's some healthy habits to also prevent cancers in general, but liver cancer as well. Eat healthy. Your body needs foods that will give it good nutrients and good proteins and everything. So fruits and vegetables, plant sources, healthy meats, healthy fats. Avoid obesity. Eat foods with lower calories, less sugar. Again, eat those healthy foods. Daily exercise, go to the gym, go out for a walk. Vaccinations, we already kind of touched on. Practice safe sex, and then visit your doctor regularly. And hopefully through these things, you'll be more aware of what might cause liver cancer and how to lower your chances the best way from having to go through that. Here are the references, and that is all. Thank you.